This brochure will give you an overview of teen depression. Eleanor Roosevelt once said that you must do the thing you think you cannot do. Feeling blue for far too long? To feel sad is a part of life, but the degree of disability and duration of sadness can transition very quickly into a serious condition called depression. Depression is a clinical mood disorder that will affect 1 in 8 Canadians at some point in their lives. Depression can affect how a person feels, thinks, and ultimately behaves, and it is often triggered by a life-changing event or an environmental stressor. A distinctive feature of depression is the overwhelming feeling of isolation that it causes and the shame in always feeling alone. It can also affect 6.5% of youth between the ages of 15 and 24. Parents and caregivers often mistake a teen's mood swings and irritability for normal adolescent behavior rather than depression. For this reason, it is important to be aware of the symptoms, risk factors, and to actively seek help. Here are some causes and risk factors. Have you ever considered how depression is caused in teens? Maybe you are wondering why you are suffering from it, whether others aren't. Depression may take the form of various common symptoms, allowing it to be mistaken for another disorder. However, here are some pertinent causes that are known to be common among teens suffering with depression. Heredity. The way your body is created and the genes making up your code are unfortunately out of your control. A history of depression in your ancestral line could cause a higher chance for you to develop depression. Struggle. This could take the form of abuse or individual conflicts between friends and family members. Someone who is biologically predisposed is more likely to develop depression through this cause. Loss. The resulting death of a close individual could lead someone to focus on the loss and tune out the surrounding events in their life. This could therefore increase the risk of depression. And finally, personal issues. The union or dissolution of a couple, a new baby, or even substance abuse could all be factors that could cause an onset of depression. Symptoms vary from teen to teen. However, these are some common symptoms that are shown to be present in most cases. These include loss of interest, feelings of helplessness, loss of energy, and irritability. Some ways that you can keep your body and mind healthy are by eating right, exercising, such as yoga and meditation, pursuing your favorite hobbies, getting plenty of sleep, and seeking help when you really need it. Many types of antidepressant medications are available, including selective serotonin reuptake inhibitors, or SSRIs. Doctors often start by prescribing an SSRI. These medications are safer and generally cause fewer side effects than other types of antidepressants. There are also many other types of medications that can treat depression, with varying degrees of effectiveness and side effects. Talking about your problems is also an important part of treating depression. Psychotherapy is a general term for treating depression by talking about your condition with a mental health provider. The key goals of psychotherapy are to adapt to a problem or other difficulty, identify some of these negative ideas and behaviors, find better ways to cope and solve these problems, identify factors that contribute to the worsening of your depression, learning to set realistic goals for your life, and developing the ability to tolerate the stress. Here are some helpful resources that you can check out. Here are the references that we have provided in this brochure. And always remember, there's always help.